Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
What if there was a way to maybe ease your worries and potentially reduce those difficult trips back to the hospital, all through something like music?
It sounds almost too good to be true, doesn't it?
Exactly. Today, we're tuning into a really fascinating area, how using music therapeutically, specifically a new kind of combined approach, is being looked at for people managing, long-term heart and lung conditions.
Right. So today, our deep dive is all about a recently published research project. It looked into whether this hybrid music therapy approach was actually practical, and if patients liked it, specifically people with heart failure and chronic obstructive pulmonary disease.
That's the lung condition.
Correct.
Yeah.
Yeah, you shared some really interesting material. There was that health news piece from April of last year, and also the actual scientific paper itself, published in BMC Complementary Medicine and Therapies.
So our mission today is to really unpack what this research might mean for helping these individuals feel better and maybe, just maybe, cut down on how often they end up back in the hospital.
Precisely. We've got info from University Hospital's Connor Whole Health, which was featured in that news piece, plus all the details from the researcher's own paper.
Okay, so let's dive in. The core problem, as I understand it, is that people with heart failure and chronic obstructive pulmonary disease often deal with really persistent physical symptoms like feeling breathless, fatigue.
Yeah, just constantly tired. And these physical things, they take a real toll on mental health, too. It's common to see depression, anxiety.
And crucially, those psychological factors can actually make it more likely they'll be readmitted to the hospital.
Exactly. It becomes a bit of a cycle, which, as you said, is incredibly tough for the patients. And it's also a massive expense for the healthcare system.
So to try and address this, researchers at Connor Whole Health started this 2-year project called MAJOR CHORD.
Yep, MAJOR CHORD.
Yep.
That's an acronym, stands for music therapy, to address patients' journeys with chronic illness, outcome, and ReadMission. Bit of a mouthful.
Hey, yeah.
But the pilot study we're talking about today was really the essential first step in that bigger picture.
And the main goal of this pilot wasn't necessarily to prove music therapy cures everything long-term.
Not at this stage, no. It's much more fundamental. Could they even do this kind of program consistently? This mix of in-person and virtual sessions.
Ah, okay.
And would patients actually, sign up, stick with it, give feedback? They really wanted to see if the whole process was feasible.
Right, sort of ironing out the kinks before launching something bigger. Makes sense. So tell us about this hybrid intervention itself. How did it work?
Okay, so they recruited people while they were actually hospitalized for either heart failure or chronic obstructive pulmonary disease.
Right there in the hospital.
Exactly. While they were still inpatients, they got 2 music therapy sessions, face-to-face. Then, after they were discharged and went home, they had 2 more sessions, but these were done virtually, online.
Okay, so you get that initial in-person connection during a stressful time, and then the follow-up is remote. How did they measure if this whole thing was, practical, the feasibility part?
They tracked several key things. First, how many patients could they actually get enrolled? Recruitment rate. Then, how many of those stayed in the study right to the end? Retention.
Got it. Enrollment and retention.
Yeah. And then, session attendance. How often did people show up for both the in-person and the virtual sessions? They also looked at how often patients completed the questionnaires.
Questionnaires about what?
About their stress levels, their quality of life, and importantly, their self-efficacy, basically, their confidence in managing their own health.
And they measured this multiple times.
Yep. At the very start, baseline, then again about 15 days after discharge, and one more time at 30 days post-discharge.
So tracking changes over that first month back home, what about the therapy itself? Did the therapist stick to the plan?
Good question.
Yep.
That's what they call fidelity or treatment integrity. They checked if the music therapist actually delivered the sessions as intended, following the planned activities. They used checklists, basically.
Like following a recipe, you said earlier.
Exactly. To make sure everyone was getting more or less the same intervention.
Okay, so feasibility checked. But it wasn't just about logistics, right? They wanted to know what the patients felt about it.
Absolutely. That's the acceptability piece. They interviewed some of the participants after the study finished.
To get their direct perspective.
Yeah. What was their experience like? What worked well? What was challenging? Did they feel like it made any difference to them?
Okay, so let's get to the results. What did the numbers and the interviews actually reveal?
All right, so they approached 113 patients and 20 enrolled in this study.
20.
Okay. Now, the encouraging part, 85% of those 20 actually completed the whole study protocol. It was pretty good retention.
That is good. What about session attendance?
That was interesting. In-person attendance was higher, 75%. But the virtual session attendance was quite a bit lower, only 40%.
40%. That does seem like a drop-off, something to dig into later maybe. And the fidelity. Did the therapists follow the plan?
Yes, they found that the therapists stuck to the session protocols over 80% of the time. So the delivery was generally consistent.
Okay. And what about those patient interviews? What were the key takeaways there?
They found 3 main themes really emerge from talking to the patients. First, having that positive connection, that rapport with the music therapist was absolutely crucial.
The human element.
Definitely. Second, there's a need to figure out better ways to keep patients engaged after they leave the hospital, especially with the virtual part. That lower attendance rate points to this too.
Right. Bridging that gap between hospital and home.
And third, despite the engagement challenges, participants generally felt the therapy had a positive impact on their mental health, their well-being.
That's really positive. Do you have any specific quotes or examples of what people said?
Yeah, some really nice ones. One person called music therapy the bright point of my day during their hospital stay, a welcome distraction.
I can imagine.
Another felt the virtual sessions offered a mental escape. Someone else mentioned specifically the breathing exercises learned in music therapy really help calm them down.
Oh, interesting. So direct techniques being used?
Yes. And another described creating music with the therapist based on a favorite song and how it felt like it just transported them away from the hospital environment for a while.
Wow. Those really paint a picture. Okay, so bringing all this together, the numbers, the interviews, what are the big implications here?
Well, I think the first big takeaway is that this pilot suggests it is feasible. Delivering this kind of hybrid music therapy in person, then virtual to these patients is possible, and generally patients find it acceptable.
So it's a viable approach to explore further.
Exactly. It's a really significant first step for potentially supporting this group who often face a lot of challenges.
And the mental health aspect seems key, right? Given the baseline anxiety and depression you mentioned.
Absolutely. The positive feedback, feeling less stressed, having that mental escape, it really lines up with other research showing music therapy can help with anxiety, depression, pain, stress.
And participants reported high levels of those things at the start.
They did.
Yeah.
So the fact that they perceived a benefit here is particularly noteworthy.
No, this was just a pilot, so they weren't directly measuring hospital readmissions, were they?
No, not directly measuring readmission rates in this feasibility study.
The
But
end.
we know that improved mental well-being, reduced anxiety, and increased self-efficacy, that confidence in managing your health are all factors linked to a lower risk of readmission.
Ah, okay. So if music therapy helps with those things.
It hints at the potential for it to play a role in reducing readmissions down the line. It's suggestive, not definitive yet.
Gotcha. And what about the hybrid model itself? Any particular advantages to doing it this way, mix of in-person and virtual?
Yeah, it seems to leverage the best of both worlds, potentially. You get that strong therapeutic bond built in person during a vulnerable time in the hospital.
Builds trust, maybe?
Probably. And then the virtual sessions offer that convenience and accessibility once someone's home. You might have mobility issues or trouble with transport.
Right, challenges that could stop them getting to outpatient appointments otherwise.
Exactly. So the virtual side could overcome some of those practical barriers.
Okay, that makes a lot of sense. But like all early studies, we need to talk about the limitations, don't we?
Oh, absolutely. Always important. The most obvious one is the small sample size, only 20 participants.
So it's hard to generalize these findings to everyone with heart failure or chronic obstructive pulmonary disease?
Precisely. And within that 20, the group with chronic obstructive pulmonary disease was particularly small, just 4 people. So we need to be cautious about drawing conclusions specifically for them based on this study alone.
And it was only done at one hospital.
Correct. A single-site study. So the results might look different in other healthcare settings, maybe different types of hospitals or patient demographics.
And that lower virtual attendance we noted earlier.
That definitely highlights a limitation, or at least a challenge. Delivering telehealth, especially to potentially older populations or those less comfortable with tech, isn't always straightforward. Engagement after discharge is tricky.
Yeah, keeping people motivated when they're back in their own environment.
And the follow-up period was quite short too, right?
It was just 30 days after they left the hospital. So while we see some positive signals in that first month,
We really don't know about the longer-term effects. Does the benefit last? Does it fade? We need more research looking further out.
Okay, so small sample, single site, virtual engagement challenges, and short follow-up. Important caveats. What did the actual researchers, the experts involved, say about it all?
Well, Samuel Rogers Melnick, who was the lead investigator, he really emphasized this study provides a kind of roadmap.
A roadmap for what?
A roadmap for how to actually deliver these interventions, how to collect the right data, and ultimately how to study the long-term impact of music therapy beyond just, feeling a bit better for an hour in the hospital. It's about sustainable impact.
Right, laying the groundwork for more definitive trials. What about others involved, like Christy Arts from Connor Whole Health?
She echoed the promise of this hybrid approach for supporting these patients, particularly for engagement and mental health. But she also, very realistically, pointed out the need to refine the virtual care aspect.
Especially that post-discharge period.
Exactly. How can we make that transition smoother, keep people connected and participating effectively once they're home? That seems to be a key area for improvement.
So definitely a case of promising needs more work.
That sums it up pretty well, I think. This initial deep dive, it offers a really hopeful glimpse, doesn't it, into new ways we might support people managing these tough chronic conditions.
Yeah, the positive vibes around mental health and just the fact that they could deliver this program, it definitely warrants bigger, more rigorous studies.
Absolutely.
And maybe for everyone listening, it's a prompt to think about music in our own lives. How does it affect your mood or stress? Could just listening more intentionally be a tool for well-being?
It's a simple idea, but potentially powerful.
Yeah. This study really opens up some fascinating questions about the future, about integrating creative therapies like music into standard healthcare. What else could we be doing? It's certainly food for thought.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.